Hello, this is Dr. Sergio Quinones. I've been asked to do a video about the most frequently asked questions of our patients and regarding the pre-op and the post-op of gastric sleeve. And this is inquiries that basically a lot of our patients have. For example, what is the purpose of the 2-week liquid diet? Well, basically the purpose of the 2-week liquid diet is to shrink the liver. It's not so much for the patient to lose weight, because sometimes it's a bit easier if the patient loses a bit of weight, but basically it's for the liver to lose its fatty liver consistency, which is a lot more difficult to handle in surgery, and it could prolong our surgery 15-30 minutes, sometimes even longer, and it can create bleedings. So basically that's our purpose of the 2-week liquid diet. It is not to torture our patients in 2 weeks and not let them eat anything at all. It is more of that. The other frequently asked question is, why would you recommend the vertical gas sleeve gastrectomy instead of gastric bypass? Well, I think we've answered that question quite a bit in the last few years. Well, basically the sleeve is it doesn't mess with the gastric or the gastrointestinal continuity, so it's basically a lot safer. We don't get malnourished patients. It's a lot better than the gastric bypass because we don't get malnourished patients, we don't get malabsorption. And if for some reason surgery should be broken, because in the case of bariatric surgery usually it sometimes is, not usually, but sometimes, the gastric bypass, we are almost not able to do anything after the gastric bypass. And the gastric sleeve we are. I mean, we can convert the gastric sleeve into a gastric bypass if need to be done, but it's a lot better. Patients don't need to take, with the gastric sleeve, don't need to take for the rest of life supplements, which it is necessary with the gastric bypass. The third most asked question is, why should a person not have caffeine prior to surgery? Well, basically caffeine interferes a little with the process of the liver, and sometimes it interferes with the fatty liver, so that's why we don't recommend caffeine. It's not that we don't recommend any caffeine at all, it's just we don't recommend the whole thing. I mean, a lot of people, when they are given the green light to drink caffeine, they usually have they overdo it. So it's basically not overdoing it with the caffeine. And the fourth question is, why do you recommend having an epidural along with general anesthesia for surgery? It's not an epidural, it's a subdural. At least what we do in the hospital, it's a subdural. And it's just basically for post-op pain and for the diminish of anesthetic gas that we use during surgery. So it's really more of a like of us, and the patients do a lot better with that. We don't need to take them to keep them with a lot of morphine or other substances. That the patient is groggy 24 hours post-op, and the patient wakes up a lot faster. So I do recommend the subdural along with general anesthesia. And the fifth asked question is, what are your thoughts about single incision vertical sleeve gastrectomy? Well, basically, vertical sleeve with one port has its indications. It has a bigger port than what we use with multiple port sleeve gastrectomy. And basically, when you have a fairly high BMI, you cannot do it with a single port. You're probably going to need an extra or 2 ports. So it turns out to be not always a single port incision. So it has its indication for some patients. It's not for every surgery and every patient. So basically, if it prolongs their surgery and we have multiple holes, that's not worth it. So basically, that's my thoughts about it. If it can be done in a patient, we'll do it. But if it cannot be done safely in a patient, we won't do it. Well, that's it about our pre-op most asked questions. I would go out to the post-op questions. Okay, so we're going to answer a few of the questions, the post-op questions of our patients. Why is it important to follow the post-op diet? Well, basically it's better results weight loss wise, and of course if you do follow the post-op diet and the chewing habits and not having any solid food for the first basically 3 to 4 weeks, well, we'll get that feeling of not having to worry about our patients being hospitalized because they ate something that was really got stuck on their sleeve, and really that happens more than I want to. I wouldn't want anyone to go through that, but a lot of people go through that because they feel comfortable that they've advanced in their post-op diet, but it's not true always. So some people try to have big pieces of chicken or meat and it gets stuck in their stomach, and of course they'll throw up. So basically that's why we need our patients to follow up with our post-op diet. That's really important. Do I have to worry? The next question, of course, is do I have to worry about blood clots after my surgery? Well, the way I do it, or the way I try to do it, it's short surgery, short stays in your bed, getting you to walk around. Basically, no. If we have patients with special needs of blood clots or prone to blood clots, we'll take our precautions, of course, but it's not a thing that we have to worry about in all our patients. We do have some patients that are more prone to blood clots than others, but we still do everything in our power just to get them up walking around. The best way to prevent a blood clot is basically to have a short surgical time and get our patients to walk around as fast after surgery as we can. So we do that, and we take quite a lot of measures to try to prevent those. The third question is, can I chew gum after surgery? Well, gum actually, it's not bad. You won't gain weight on it. But the thing is with gum is that you chew gum, you swallow saliva, and at the same time you swallow air. So you get a lot of air into your sleeve. And after that, you may think it gets rid of the anxiety of you wanting something if you have that something to eat, but it actually makes you a lot fuller because you have air in your stomach. So it's not really recommendable. That's not what I recommend. And the fourth question is, how long does it take for my sleeve to fully heal? Well, the sleeve, it's one part. The abdominal wall is the second part. The sleeve itself takes usually about 3 to 5 days to fully heal. The stomach's a really fast healer, but the abdominal wall takes a longer time than that. Usually it takes about 3 weeks, sometimes 4 weeks to fully heal. So you may want to look into it. I mean, we're talking about the sleeve and we're not talking about the abdominal wall. So the abdominal wall is making those big efforts that can get you in a lot of trouble. So you have to check about with those. But the sleeve itself will close in about 3 to 5 days. It depends on the patient, of course, age and everything, but it's 3 to 5 days basically. And the fifth question is, why do I need to wait 30 minutes before I eat and 30 minutes after 30 minutes before I eat and 30 minutes after I eat and drink something? Well, the 30 minutes, it's not a rule, but basically it's a time that it takes for your stomach to just get rid of something that you had for a meal, and then you have something to drink. Why? Because you're not going to be able to drink a whole lot after a meal. So basically we want first the food and then the liquids. Not in that order, but we want that to be a priority because we don't want a malnourished patient, but also we don't want a dehydrated patient. So basically just wait 30 minutes in between liquids or meals before you go do either one of those. Wait till the stomach is fully empty. Basically the patient can't feel it. I mean, when the stomach is empty, but that's why we use the 30-minute rule. It's not always 30 minutes. Sometimes it could take longer with some patients, or it can be shorter amount of time, but that's why we use the 30-minute rule. Feel free via internet, via our chat to ask questions. I'll happily answer them to the best of my knowledge and to the best of my abilities. We don't have to worry about that, so just ask me and we'll try to do this every week. Thank you.